Hello everyone, and welcome back to my channel. My name is Dr. Stephen Roth, and I'm a board-certified oral and maxillofacial pathologist. Today's video, we'll be switching things up a bit. I'm excited to share some personal news with you and also have a very special guest interview who, as I'm sure you can tell by the title of the video, is Dr. Morten Hinge of Morten Vet Dentist on Instagram. If you want to skip ahead to the interview, you can go to the timestamp below or use the chapter tools. First, just a quick disclaimer, and that is that all opinions expressed in this video belong to us and do not represent any organization that may employ us or that we may belong to, and that this video is for educational purposes only and should not serve as medical advice. Should you have any concerns about you or your pet's health, please see your nearest human or animal healthcare provider. And with that being said, let's get into today's video. Before I graduated from dental school and moved to New York, I began to consider adopting a dog. In my search, I remembered an instance from a family trip to Florida where my dad, who is by no means an animal person, mentioned that if he were to adopt a dog, it would be a retired racing greyhound to give it a better life in retirement. I began to research different breeds, and the greyhound popped up again. Greyhounds are known for their quiet, kind, loving nature. They have short hair, so they don't really smell or shed much, and they're couch potatoes that sleep between 16 and 20 hours a day, which makes me feel less guilty working full-time and living in an apartment. For the past few years, through residency and transitioning into becoming an attending, I was waiting for the right time to finally adopt my dream dog. About a month ago, I decided it was time and I was ready. I reached out to a few greyhound adoption agencies and was told that due to the end of racing in 49 states, with Florida, the mecca of greyhound racing, shuttering at the end of 2020, greyhounds were not available to adopt. Currently, only West Virginia races greyhounds. Fortunately, Bobby from the National Greyhound Adoption Program in Philadelphia let me know that an older retired racer was returned to the agency to be rehomed. I met him that weekend and was instantly connected. The dog I met's name at that time was Flynn. He was 9 years old and raced for 2 years in 2013 and 2014 under the name Deco DM on Fire. Looking up his racing results, he did win one race and placed in third twice. Racers have a racing name and a kennel name, and this dog's kennel name was Otis. Because I wasn't a huge fan of Flynn and he didn't really seem to respond to Flynn when I would call him, I renamed him Brutus in honor of my alma mater, Ohio State's mascot. I figured Brutus was close enough to Otis that he wouldn't be too confused, and fortunately, he's really taken to the name and always responds when he hears it. In fact, he's waiting off camera with his ears perked up right now, waiting for his treat. Brutus and I have been together for 3 weeks, and we've connected right away. Brutus is house trained and crate trained. He's a great eater and an excellent walker. He loves driving in the car, and the only toys that he has interest in squeak. Fortunately, he doesn't like to squeak them himself, he just likes to collect them and sit them all around him on his favorite spot on the couch. He does sleep quite a bit, and he can sleep in funny positions, but he always comes over for pets and scratches when he wakes up. Brutus is the first dog that I've ever owned, and he has made my transition to dog dad so easy and seamless. I know that Brutus is in his twilight years at 9 years old, with greyhounds having an average life expectancy of 10 to 14 years according to Google, and I don't know how much time we'll have together, but I plan to make the most of it. That leads me to our guest. In preparation for Brutus's arrival, I wasn't sure what to do about his oral hygiene. I know how to treat human teeth, but dog teeth were completely new to me. I knew that many dogs have periodontal disease and need cleanings, but wanted to make sure I was doing everything I could to keep my new companion healthy. I've been following Dr. Morten Hinge on Instagram for quite some time. His page is absolutely fascinating. His scope in dentistry is so broad, from orthodontics to periodontics to endodontics to prosthodontics, it seems like he does it all. I sent Dr. Hinge a DM on Instagram, not expecting to hear from him. After all, he has over 36,000 followers, and some of his reels have over 1 million views. But much to my surprise, he did respond. And not only that, but he had seen some of my videos. I just about hit the floor. I felt like I was recognized by a celebrity. After Dr. Hinge gave me some excellent tips to keep Brutus's oral health up to snuff, and I bought this really cute toothbrush and toothpaste holder, I asked Dr. Hinge if he would be willing to do an interview for the channel so that he can share all of the knowledge I was lucky to receive with all of you. And again, he so very graciously agreed. Seriously, he is the best. If you haven't followed him already, stop this video and use the link in the description to follow him. Such a nice and caring provider that is willing to share his knowledge and do so in accessible ways. Just a warning that I will be showing some more graphic surgical pictures during the interview from Dr. Hinge's Instagram. So if you're triggered by this content, it would still be beneficial to listen to our interview like a podcast, but maybe look away from the screen. All right, enough of the setup. Enjoy my discussion with Dr. Hinge. Hello, everybody, and welcome to our interview with Dr. Hinge, here coming from Denmark, or you may know him better as Morten Vet Dentist on Instagram. I'll put the link to that Instagram down below, but with over 30,000 followers, I'm sure most people that are watching this video already know Morten well, and I'm so grateful to have him here. I recently adopted a dog, and I was looking for help, and I DM'd Morten, not expecting a response from an Instagram celebrity, and he was so helpful. So I was hoping that maybe he could spread some knowledge with all of us here today about what it's like being a vet dentist and some vet specific pathology. And Morten, I'm going to turn over to you if you wouldn't mind introducing yourself and sharing a little bit about who you are and where you are and what you do.
Yeah, sure. Thanks for having me. It's a fun invitation to get from an oral pathologist. It's something we deal with a lot in vet dentistry, so it's kind of cool. But I'm a veterinarian of profession, and I've been a vet for 10 years now, since 2012. 37 years old. I have 2 daughters and a wife, and I'm situated in Denmark, Europe, in a clinic of small animals, so companion animals, dogs and cats and rabbits and so on. I am fortunately enough to do exclusively dentistry. And dentistry is something that's very prevalent in the practice, and we see it every day. And so I've been doing a little bit of everything. Started out as in mixed practice, so I was treating cows and horses in the morning, and then small animals in the afternoon. And then I suddenly started to shift more towards dentistry. So there's a little bit of a background for me.
Perfect. And what made you switch that way? So you started as kind of a whole body medicine person. What made you kind of focus on teeth?
Well, I've always liked surgery and being in the operatory room compared to standing in taking consultations every 20 minutes all day. So and then my boss, she showed me some dental tips and tricks, and a little bit of surgery and so on. And soon I was taking over that field within the practice. And then I went to a lecture of an American diplomat. It's called Brooke Nimick. He's also very active on the internet, and his lectures was just mind-blowing. And I saw a full day of his lectures in Denmark, and I thought, okay, this is what I'm gonna do. This is awesome, because it's not just plucking out loose teeth. It's so much more. So he introduced me to all of this stuff. And then I stumbled across another American gentleman called Brett Beckman, also a diplomat, so a specialist. And I went to Florida to visit him for a weekend course, and I bought his courses, online courses, and so on. That's where I kind of knew this is what I'm gonna do for the rest of my life. And as of 3 months ago, I started doing only exclusively dentistry. So no more skin problems, eye problems, no, nothing. I got other people to help me with that, and that suits me. That suits me well.
Perfect. Yeah. So most of your patients, do they come from within the practice, or are you getting referrals from outside veterinarians? Are people kind of seeking you out on their own? How do you get your patient base?
Yeah, a little bit of both. Most from within our own practice, from vaccinations and health consultations and so on. And then once my colleagues look in the mouth, in 9 out of 10 animals, they see oral pathology, and then they send it to me. So it's very, very regular to find disease. And then I'm fortunate enough to get some referrals also, and I'm working on getting more. And so this will be my goal for the next couple of years, to try to do, I have a trainee now that I'm working, learning him everything I know, and so he can do lots of the extractions and all of the other stuff, so I can kind of focus on the referrals. But I love doing both, and so I'm fortunate to do a little bit of everything.
Yeah, it does seem that way from your Instagram. You're doing, taking impressions and placing crowns, doing a lot of endo, doing a lot of perio work, doing a lot of extractions. It seems like you're kind of running the gamut. Your most interesting post, or your most recent post that I found interesting, was the dog braces. How often are you doing doggy braces?
Yeah, not that often. We see a lot of, we call it lingo-worded canines. So the lower canines, mandibular canines, are positioned wrong. They're up, pointing into the palate, and oftentimes they actually make huge holes up in the palate. So we have to correct that. So usually we find it at the puppy age, and then we extract the deciduous teeth, and by the time they're 6 months, they will have shedded them anyway, and the permanent ones erupt, and then we can start to adjust those if needed. So those kind of adjustments we can do crown extensions to do that. There are some incline planes, spite planes, and so on. So there's stuff we can do to correct that. But I mean, the bread and butter of veterinary dentistry is extractions, for sure, surgical extractions. And so periodontitis is the number one disease, and it's the most prevalent disease out of all diseases with animals. So, and it's the one that has gotten the least amount of attention, at least in vet school. They don't teach us much about dentistry, and that's I find that it's wrong, because when I was in school, I scaled and polished a quarter of a mouth. That's it. I probably had like one lecture or something, I can't remember, on periodontitis, but not something that sticks. So everything we know, we learn it after school, and it takes some dedication to go down into that path. But fortunately, there's lots of nice courses and so on, so we can do that. So you have to have got the interest to pursue it by yourself, all this knowledge, and it's not as specialized as in humans, where you have like an endodontist and periodontist and so on. We have to kind of cover everything. So is it 9 or 10 different areas there?
We're up there.
Yeah, I try to learn as much as I can about every discipline and do it as good as I can. Yeah.
It's kind of interesting. You're doing things in your practice that took us dentists 4 years to learn, and you're kind of having to take the initiative to learn how to do endo and brace orthodontic movements and prosthodontic movements with bite planes. It's very impressive.
Yeah.
But you mentioned the perio being the most common condition that occurs in pets. I obviously don't do much with perio, so I do more with the other pathology. What are some of the more common pathologies that you see in your patient population outside of perio, which you mentioned is extremely common?
Yeah, we see lots of fractures, lots of uncomplicated fractures, lots of complicated fractures where the pulp has been exposed, and that's usually due to dogs chewing on bones, antlers, nyla bones, all this stuff that you can buy at every pet store, and they will try to sell you because it's good for the dog's teeth, and it will clean the teeth and make it stronger, and all this stuff they tell you, but it's completely wrong. Everything is wrong. So that's one of big misconception within owners, and it's so hard to be a pet owner because you get mixed information from everywhere. And so the thing about giving your dogs bones, no matter if it's boiled or not, they will break break the teeth. We see lots of we call them slab fractures, where the fourth premolar is the big teeth back there, and they use it to chew with, or at least use it to rip off the flesh from from the bones, ironically, from back in the day when they were hunting animals. Back then they also had lots of fractures, but now we are supposed to take care of the animals so as good as we can. So that's why we need to stop giving them bones and antlers and plastic and so on. A good rule of thumb: if you can indent it with your fingernail, or if you can bend it a little bit, then it's safe to use.
Perfect.
So that's the tip.
No bones, no antlers, no nyla bones. Stay away from those.
People will say, they will tell you, well, they remove tartar from the teeth. Yeah, they may remove a little bit along with a piece of the tooth. So this tartar that was on the piece of the tooth that just came off, they will remove that. So they're kind of right.
And you kind of mentioned that pet owners do kind of fly blind a little bit. I know that when I first got my dog, I was interested in brushing my dog's teeth because I'm a dentist. So that's why I reached out to you. And one thing that you told me that was very interesting was about dogs and caries or cavities. And dogs don't really get cavities. And I was hoping that maybe you could talk a little bit about why that is.
Yeah, sure. So there are two main reasons for that, or actually three main reasons. One is they have only like two occlusal surfaces in the mouth. So the teeth are positioned in dogs and cats, so they don't actually touch each other. They are not made for chewing. They are made for ripping and swallowing. But there are a few molars that actually have occlusal surfaces, and that's where you see the caries. But the caries, in my 10 years, I've only seen caries twice, I think 2 times I've seen it in 10 years of all the patients I've seen. And another reason is the lack of sugar in the diet. Sure, they have carbohydrates, but they don't have the sugar of the diet. And then lastly, the pH value is much higher in dogs and cats. In cats, it can approach pH of 9 in a cat. So, and that's also very inhibiting for getting the caries. So those are the reasons. Actually, we don't really see it.
And you mentioned kind of the lack of sugar in the diet. It's interesting that you bring that up. I just recently took my dog to get ice cream with a friend of mine who is also a dentist. I'm not going to say their name because I don't want to shame them. But I did, maybe sneak a little bit of ice cream, which I know is bad. Dogs don't really digest milk sugars, but my friend insisted on using the same spoon to feed my dog. What is your I want to settle the tie for us, settle the argument. Should humans be sharing utensils and kissing dogs on the mouth?
Well, if you don't have a problem with fecal matter getting in your own mouth and sharing some of the flora from the dog's mouth, that's perfectly fine. You can do that. On another note, I would say lots of people are giving their dogs raw food, and so you also have the risk of the getting Campylobacter and so on from that food. And so generally, I would say no, don't do it. I mean, it won't kill you, it won't, but I don't, it's kind of nasty, isn't it?
Yeah, I agree. That was the side of the argument I was on. So that friend that I went to get ice cream with that's watching this, you heard it here first. That question was just for you. But to move away from that a little bit, obviously, as an oral pathologist, I'm interested in kind of your interesting cases and kind of the more pathology side. Do you have a case that sticks out to you that was especially memorable or especially rare, or something that is kind of different and weird that you don't think you'll see again?
Well, I've seen, we see quite a lot of huge cysts. Dentidious cysts and they can get very massive, really massive. And so I have a few cases where you just have to open up and start scraping out those that epithelial lining and get into it. So those kind of stick out. And then I had a few years ago, I encountered a case of a big tumor on the maxilla, and it was on the right side of the maxilla, and it, I had to talk to a friend of mine who's a specialist and have him come in to help me with the surgery. And it was very interesting for me. And it was a very big maxillectomy, and it was jaw dropping for me seeing him, removing half of this dog's, jaw, and just, being able to stitch it back together, and you couldn't even see it on the dog afterwards. So those are the things that are kind of interesting. But we also see, all oral cancer and neoplasia is very common in dogs, in the mouth, also of dogs and cats. And there's a few ones that are more common than others. I mean, there's squamous cell carcinoma. Cats, they tend to get them at the base of the tongue. So in cats, it's a good idea to lift the tongue, look at the base, see if there's anything growing there. Then we got the melanomas. They can be amelanonic. What do you call it? Well,
amelanonic, yeah, not brown or pigmented.
Exactly, we see that, and we see osteosarcomas also. Lots of the new name for it is peripheral odontogenic fibroma, and it's been called, I don't know if there's a lot of discussion on what to call it, and back in the day everyone just said epilis, that's an epilis, and epilis here and epilis there, and epilis is just a
bump on
a word for growth, some sort of growth, and it doesn't tell anything. So that's a big misconception between vets still, that they say, oh, this is just epilis, we can just cut it off and that's fine, and so more biopsies could be made, and it should be made. So, but it's like a fibrous proliferation of the periodontal ligament, and usually I would do like an excisional biopsy or incisional biopsy, submitted. I always take pictures, clinical pictures, and submit the X-rays. I know that makes the pathologist happy.
Yeah, all of the oral surgeons out there, listen to what Morten does, because we love to see pictures and X-rays in humans too. It's very, very helpful.
Yeah, and every time I send a picture, the reply is, "Thank you for the clinical images. It was very helpful." And so I'm in my mind, I'm getting a better diagnosis, if I submit everything I have. And then if it comes back, you kind of have to remove the tooth also, because you gotta get rid of the periodontal ligament. But that's probably the most common thing we see in dogs. That's the fibrous epilis, sometimes ossifying epilis of the periodontal ligament. It's very common.
And we see that in humans too. It's one of the things that we see. Usually we're a little bit more conservative. We don't necessarily take the tooth out, but it does come from the periodontal ligament. So it usually results in a periodontal defect. You really got to scrape the crap out of the tooth to make sure that it doesn't come back. And it still comes back in about 15% of cases.
Oh, really?
So a little bit of overlap between animal and human pathology.
So if you don't remove the tooth, how often will it grow back?
About 15%.
Oh, 15, okay.
15%, yeah.
Okay,
But we know that human pathology and animal pathology is a little bit different. In fact, you talked to me about a case on the tongue. What was that called?
Oh yeah, it's called Calcinosis circumscripta.
Yeah.
And supposedly, I didn't know about this until I probably seen it, but I didn't pay attention to it. I had like 2 or 3 cases within the last month, and it's like calcium salts deposits, white deposits inside of the tongue. You can get it on the feet also, and but it's supposedly it's believed to be caused by trauma of some sort. And I'm not sure yet if you should, because what I read is you got to remove it surgically, but I also have some people telling me that you can just leave it and it will go away by itself. So there's not a huge consensus about, you know, how to deal with it, as far as I know right now. So I'm looking into that. But you haven't really seen it in humans.
No, in humans, if we see something calcified in the tongue, it's usually fully developed bone. We call that an osseous choristoma. We don't usually see calcium deposits. There is something similar in the skin, calcinosis cutis, but I've never seen any intraoral cases of it. But it's interesting, the different pathologies that you have between species as well.
Yeah, yeah.
But
it's the oral pathology is I think it's very interesting, and it's something that deserves a lot of attention, and but you know, we kind of rely on the answers we get back, but it's a field you should you know, get a nice book. And there's a new book for veterinarians of that has like the newest abbreviations and newest words and so on in it. So but it's you know, it's a hard subject. I have much respect for what you do, because, you know, the things can look kind of the same, and but you need to, you know, have you need to have a eagle's eye on things to see, you know, see the patterns, and yeah, it's fascinating to me. Yeah.
are you just saying that because you're on the call with me, or
no. No, but it fascinates me. You know, I'm happy to have a pathologist I can submit stuff to. You know, it makes our work a lot easier.
Yeah, and that's a good plug. When I was a dental student at Ohio State, there was a veterinary pathologist that did kind of work very closely with the group, and he would go to their case exchange and he would sit with them at the microscope, and they really are very qualified, excellent people. So any veterinarians that do biopsies or perform excisions anywhere in the body, just know that you should be submitting that tissue to be getting diagnoses. Same with humans. You know, you don't want to cut something out of a human or an animal and not know what you just removed, because you really do require histology.
Yeah.
How often would you say you're doing biopsies, do you think?
A couple of times a week, I think. So for every 15 patients, probably do a biopsy, I think.
Oh, wow. Yeah. That's pretty frequent.
Yeah.
That's pretty frequent.
There's lots of pyogenic granulomas from trauma and so on. Lots of stuff confusing you. Lots of gingival hyperplasia due to inflammation from the periodontitis and so on. So I would say 95% of the answers I get back are benign.
Yeah, that's about the same with humans too, but it's good to submit, because the 5% that isn't benign, you don't want to miss that. So I have a few questions that were submitted. The first is from the Perio Princess, who wants to know. What was that?
We talked on Instagram.
Yeah, she's great. I met her recently at a 40 under 40 event here in the States. She's a good person to know.
She gave me good advice. Yeah.
Good. Yeah, she, being a periodontist, it's helpful when you're doing a lot of perio work. What is your favorite extraction instrument?
Well, it's my extremely sharp luxator, and people tend to have elevators and use them as luxators. I think, you know, I threw all those out because they break the roots. So I have some luxators that are I keep them very sharp. I have a sharpening machine that I use all the time, and it can cut through anything. So that's, you know, once you have a tool that can slide into the periodontal ligament, then you're very far. and lots of people unfortunately don't know that, you know, the right tool to get and so on. And besides that, when doing surgical extractions, I found a long burr that's about 3 centimeters long. Oh, wow. And it's very, very thin, and it's called a root tip burr. And it can, so when we surgical remove teeth, we make a mucogingival flap, and then we remove the alveolar bone on the buccal side, and then once we kind of expose the root, we can expose up to 100% of the root, actually in dogs without a problem. And then you make the modes on each side of the root, and then you can kind of twist and get the tooth root out. So in veterinary medicine, we are more aggressive than in dentistry. We don't have to worry about preserving alveolar bone, because it's not like in humans that we don't have cosmetics to deal with. We don't have to deal with cosmetics. We don't have to put in implants. We don't have to prepare anything for an implant placement, because dogs, no matter what tooth or how many teeth you remove, they eat perfectly fine. And that's one of the big misconceptions also in dentistry with animals, is that they need teeth to eat. But it's actually not true. If you've ever seen your dog vomit, usually the food that comes out it's just the kibble, still the normal size kibble that comes up. Only a few of it is chewed, the rest of it is swallowed. So we don't have to worry about all that. So we kind of get very aggressive because we want to go in hard and we want to get the tooth out quickly, because all of our patients are under full anesthesia, general anesthesia.
And help with pain too, I imagine, by getting it out, making sure that it's done right the first time, it will help minimize pain.
Yeah, and I use the local blocks I use bupivacaine. What do you call it, bupi?
Yeah, bupivacaine.
Bupivacaine,
Yeah.
I use that. It gets a nice duration of action and it works perfectly. Yeah.
Perfect.
So that's my favorite, actually two favorite instruments.
Excellent. A question from Carolyn Michaels, who's also an oral pathologist here in the States, wanting to know if you can apply topical fluoride to dogs, even though they don't get caries very frequently.
Yeah, see, it's extremely rare that we do that in veterinary medicine. I did it probably once because I had like a exposed tooth, the neck of a tooth root, that I thought maybe I got a sample from someone. I needed to try it, but it's not really, you don't really need to. And fluoride can be toxic to dogs anyway, so you shouldn't do it on a regular basis. I don't really, in my opinion, you don't need to worry about fluoride at all for sensitivity and so on in dogs.
All right, you heard it here first. No, don't steal any fluoride treatments and put it in your dog's mouth.
They don't like the human toothpaste also. Usually the toothpaste, dogs use are with meat taste or chicken taste or cat taste or whatever.
Do you have a recommendation for toothpaste? I remembered you mentioned that there's something to look for.
Well, it just, to me, I always tell the owners, it makes the experience nicer. So it has to be something the dog likes. It can be, you can brush with whatever. There are toothpaste with some enzymes in it. I'm not sure there are a huge amount of studies that actually say anything that they're very beneficial. To me, the benefit is the friction itself. And using just water is maybe not it's maybe a little bit boring for the dog. So to increase the compliance, we use toothpaste with meat or with taste. Usually liver taste, or so you can use whatever. You can use whatever you want, and you don't have to worry about food sitting on the teeth after you brushed it. That's why you can brush with food if you want, because they don't get cavities. So that's a little trick. If you have a dog that's perhaps motivated by food, then get the toothbrushing done before it eats. So it learns that once you're done with brushing, you get your food.
Yeah, my dog is taken to the peanut butter flavored toothpaste, which is great because I don't have to smell the liver or cheese smell from the other types. So it's great for everybody. But you mentioned we talked a little bit about about brushing teeth. This question came in. What oral home care recommendations or tips should dentists be giving our patients with pets who ask about it? And if you have any product recommendations, which we kind of touched on a little bit.
Yeah, just use a soft brush, baby toothbrush, or a brush with many bristles. They have to be rounded in the top, so they're very soft. And you have to brush at least once a day. But the thing with dogs is you just brush the outside. So you can actually keep the mouth closed and just stick the brush in between the lip and the teeth. You don't have to really watch what you're doing. You just feel the teeth go back and forth a few times in each side, and then you're done. If you want to be a champion in this, of course you can do more. You can lift the lip. If you have a compliant dog, it's way easier. But the thing is, you don't if you cannot reach the inside of the teeth, don't feel bad. Don't try to struggle and fight with your dog to reach the inside, because the tongue will get rid of most of the plaque on the inside. So usually we recommend just to brush the outside to make sure that they actually get it done. And that's a big thing. Even though I talk to many owners and they tell me how often they brush, and they do it every day, but when I look at the teeth, it tells a little bit different story, perhaps. So don't expect people to brush. I mean, maybe 1% will actually commit to it. So in my situations, all my patients, I have to, the treatment plan I make, I have to have in consideration that they are not going to brush. So if you are a dentist and you are doing a treatment plan on a patient, think about it this way. This patient, when it leaves my office, this patient will not brush the teeth ever again. It will come back in 7 years, because one dog year equals 7 human years, and it's kind of a nice estimate, because that's how fast things progress in the mouth of dogs, actually. So my tip number 2 would be go to the veterinary dentist once a year. If they had to extract teeth before, go twice a year. And that's my kind of rule of thumbs.
That's good advice. I am proud to say I'm part of the 1% that does brush my dog's teeth every day. So far, it's still new, so we'll see. But
of course,
we'll see.
I'm sure you're doing a good job, and you will display your dog's teeth right here after this show, and with a picture. No, but another thing you have to, when you talk to patients that has dogs, make sure they go to a veterinarian that does X-ray, dental X-ray. We don't just take pictures of the crowns. We need to have the roots, all the roots. So the regular bite wings, or what you call it, it's not enough. We need the whole tooth on every. So with my patient, we do full mouth radiography, full mouth radiographs in every patient.
Excellent. We've been talking a lot about dogs, and you've been good to insert different cat facts. That's because I'm definitely showing my bias here, that I'm definitely a dog person and a new dog owner. But a question from Heather Doherty Wood, who is a dental hygienist from Ohio State. When I was there, she was on faculty. She wants to know, what are the signs of tooth problems in cats, and how do cat teeth compare to human teeth?
Yeah, excellent question. Cats are a little bit different. They get tooth resorptions very easily. So that's a big thing in cats, that's tooth resorptions. And we put them into 2 categories, type 1 and 2. So one is a replacement resorption, when the roots gets replaced by bone. And the other one, the roots are intact, but the lesions are in the crown. And it starts from within, so within the dentine, and then suddenly the layer of enamel that covers it will kind of sink in, and then you have your lesion. And that's when it starts to be painful. That's when you can see it when you look in the mouth of the cat. And that's very painful. So, but the signs of dental disease in cats and dogs are very, very subtle. And you cannot, no matter how well you look at them, how well you know your dog or your cat, you cannot really tell by their actions whether they have all pain or not, whether they're in painful. And a huge misconception that I hear every day, and I try to address it before the owner tells it to me. Every time I say, your dog will still eat no matter how painful it is. You know, you will not be able to see. You cannot recognize dental pain. It still eats. And people think, well, it still eats, so it cannot be in pain. And that's completely wrong. Completely wrong. They will eat to survive. They will deal with the pain. They don't have the urge to tell everyone around you that you are in pain, like us people do, us humans. So they just deal with the discomfort and just move on with the life. But the little signs you can see is they start to, you know, move away from the owners. They may be sleeping a little bit longer. They don't want to get up in the morning. They don't pick up the ball like they used to. Prefer to keep for themselves. And once we get rid of all the disease and the pain, that's when the owners give the feedback to me that they feel like they've gotten a whole new dog, and they thought it was just getting old. And then they get, you know, they feel bad because they missed a lot of, but you know, my own cat had 2 tooth resorptions, and I didn't notice anything. I just took him in because of the time, and I found it. So, and I know lots of vets and vet nurses that have animals with problems, and you just don't see it. You know?
Is there anything to do to prevent the tooth resorption, or it's just a matter of coming in for regular checkups?
Yeah, regular checkups. You cannot prevent it by any means, no, unfortunately.
Yeah, that is. So you heard it here first. Make sure that you're going to a vet with dental x-rays. Especially if you have a cat, but definitely if you have a dog as well. Morten, that's all that I had. What was that? Sorry.
Yeah, beginning at the year 1 year of age. That's a good age. Because oftentimes I see them when they're 5, 6 years old.
It's too late.
And the vet may have looked at the mouth and said, "Oh, there's not enough tartar. Looks kind of fine. Let's wait another year. It's not bad enough yet. Let's wait." And that's, you know, I see those dogs down the line, and then that's when we have to do 25 surgical extractions. And people are like, "Well, I went to the vet every year to get my vaccinations. They never told me that they have a problem." So that's the thing that we have to educate some of, you know, it's better to prevent. Imagine you went to your dentist and he said, "Oh, I see a little bit of, you got some gingivitis, you got a little inflammation on your gums here, and there's some recession and a pocket, but you know, it's not bad enough. You know, come back when the tooth get loose, we can plug it out for you, and you know, it's we can do better than that." But so yearly checkups from starting at the year 1. If you have a very small dog, you're fortunate, you have a large breed dog, but if you have a very small breed dog like Chihuahuas, Maltese, Yorkshire Terriers, and so on, the periodontitis starts at usually around 9-10 months of age. That's when they start to get periodontitis. I've removed molars from a Yorkshire Terrier that was 9 months old from periodontitis and bone loss. They cannot. It's in their genes. They cannot really deal with their own plaque, so it's kind of a sensitivity towards the plaque, and then the tissue starts to break down and so on. And there's also, it's partly also due to breeding, because we breed the dogs smaller and smaller and smaller, also more brachycephalic, shorter noses, so there are not enough room for the teeth. It's a lot of crowding, lots of places food can hide and get stuck in bacteria and plaque and so on. And that's part of the reason why the small breed dogs and the pure breed dogs actually are kind of more predisposed to getting periodontitis. You can have a German Shepherd, 12 years of age, with very nice teeth, never been to the dentist, and then you have a 1-year Maltese with several problems. So that's a tip too. Look at your dog. If it's under 5 kilos, you book an appointment tomorrow.
Yeah, no kidding. I've learned so much, both in our private conversations and today. I'm so grateful that you took the time, especially because it's about to be 9 p.m. over there on a Saturday. Thank you so much. Is there any final thoughts that you wanted to put out there?
No, it's been an honor talking to you, and I have to read more about oral pathology because it's such interesting, and it's been great being on here, and I hope that lots of your followers with animals, they will look at the teeth and perhaps get a checkup.
Perfect.
But, it's been fun. Yeah.
Thank you, Morten. I appreciate it, and enjoy the rest of your evening.
Thank you. You too.
Thank you so much again to Dr. Hinge for taking the time on a Saturday night to speak with me so that all of us can learn. As I mentioned before, I've linked Dr. Hinge's Instagram account below, though I'm sure most viewers are already following. Also, I've linked Dr. Hinge's online courses if you're interested in learning more about specific topics in veterinary dentistry. Dr. Hinge mentioned to me that he will soon have a web portal with all of his resources available soon. And once that's up and running, you'll see that in the description as well. I also wanted to thank the National Greyhound Adoption Program, especially Bobby, for helping connect me to my new roommate and furry friend, Brutus. Finally, I wanted to express an extreme amount of gratitude for reaching 1,000 subscribers. Never did I imagine that many people would subscribe to this channel, so thank you. If you're new and want to join the party, hit the subscribe button below. Leave a comment if you like this interview style video, as I have a few other guests that I'm considering reaching out to, so let me know if you want to see more interviews just like this one. Thanks again for watching, and be well.